everybody, it's Brian, physical therapist, and today I'm going to show you a really interesting exercise called a wall walk. Okay, so we're using the Miniband or just the loop band, and again, you could use any, you can buy these or you can just get a thick band and just tie it to how you want it, but these are just nice because they're ready to go. So this is a stabilization exercise. So again, I'm talking shoulder, rotator cuff, upper back. Very simple. You're going to stand and you're going to keep your hands at about shoulder height, and you're going to start below shoulder height because again, if you have a shoulder issue, you start going up overhead, that's going to be painful. So I like to start a little bit lower and my hands kind of apart. Okay, so there's some tension. I don't want them so close and it's all flappy. That's not good. We want to get the stability. We want strengthening. Okay, so I'm going to show you how this works, and it's very simple. It's a very effective burner for your upper back, shoulder blade area. Okay, so one arm is a mover arm, one arm's the stabilizer arm. So in this instance, I'm going to show you first my left arm is going to stay and my right arm's going to move, and then we'll switch it to the opposite. So very simple. So my left arm is stabilizing. I'm going to work 3 different positions with my right hand. I'm going to diagonally come up and tap, so to the shoulder height, and then come back to the center part. And then I'm going to diagonally touch out to the right and come back to the center part. And then I'm going to diagonally touch down and back to the center part. So that would be one set, okay, for the left side. So now if I'm going to switch it and do my right arm, so now my right arm is still and my left arm moves. Okay, so this is stable. I'm going to tap up, shoulder height, come back to the center, out to the side, back to the center, diagonally down, back to the center. Okay, so right and left, that would be those 3 positions. So diagonally up, side, and diagonally down is 1, and then you do the other side. And you can do I usually do about 5 sets of those. So those 1, 2, 3, right and left is 1. I would do that 5 times, 5 cycles without pain. And that's a great exercise, and you're going to feel a really good workout with it. Again, you can change the angle if you want. If your shoulders are pretty good, you want to try a little higher, you can go a little higher and do that, and that's fine too. But I always like to start a little bit lower, making sure that doesn't bother the shoulder. And again, the farther you go, the more taut, the more strengthening, and the more challenging it is, and it's a good progression. So again, this can be done once or twice a week or as instructed by your therapist.